Hello, and welcome to week 3 of Level 3 Health and Social Care, Unit 304, which is Person Centered Care. As I said, we're on week 3 now, which is part 5 in my slides. We've only got one set of slides for this week, but I have got some case studies that I want you to look at as well. So, a bit more private study time in addition. So today we're going to look at medical ethics, and these slides are really going to address two criteria that we have. That's 2.1, which is discuss ethics with particular reference to medical ethical principles, hence that's what we're talking about. And also 2.2, assess the ethical issues from the case study and how these can be resolved. I will introduce the case studies later on, and they will be available online for you to have a little practice run at before you actually do them for your assignment. Okay. So medical ethics. Let's think about what are ethics. So, what is the origin of ethics? It comes from the Greek words, as quite a lot of language does. Ethos, which means customs or habits, so things that we always do. And it's often called moral philosophy, really. So it's about what people think is right or wrong, really. And the word moral is from the Latin mores, which also means custom or habit. So you've got the Greek on one hand, and you've got moral on the other hand, which is Latin, which will be the Roman. So not a lot of difference. So both fairly ancient languages, and both feed into the English language to create this. So ethics really means a science or customs of habits of society. So those, if you meet a professor of ethics at a university, that's really what they study: customs and habits of society. And one of the oldest doctors ever known, really, was the Greek Hippocrates, and born on the island of Kos in Greece. And he started one of the first medical schools, really, all that time ago in ancient Greece. So before the Romans, this is ancient Greece. And he was a guy who, as well as introducing all sorts of ideas, but mostly about education, but he also sort of considered a certain ethical and moral standard. And to meet this standard, he created something known as a Hippocratic Oath. And once doctors had graduated from his teaching, he made them all swear the Hippocratic Oath, which was about treating people fairly, imparting their knowledge in a moral way, an ethical way, doing no harm, using your best judgment and best ability. Don't causing any harm intentionally. And have a little read of the Hippocratic Oath here, and then you will see that the modern doctors nowadays, they still take this oath, although it's been translated a little bit into more modern English. So you could probably Google a version of it if you want. But you can sort of compare it to Hippocrates, which is many hundreds of years ago now, really. And and sort of see that it hasn't really changed that much. It's about making an oath to say that you respect people, you won't do them any harm, you will keep their information private. So even Hippocrates was concerned about confidentiality, really. Everything you will do will be for benefit. You won't seduce males or females. um, you won't do any corrupt acts in your, it's about sort of being above criticism, really, as a doctor. And they, as I said, they still swear the Hippocratic Oath today. So, what is ethics to us? As we said, they're the rules and conduct recognized by human action. So, it's really related to the culture of the place that you live in. Ethics could change from what is ethically acceptable in one country may be different in another because their culture says so. So, it's a little bit fluid. But it's really about what is considered sort of right or wrong in that culture. Bioethics, you will hear the word bioethics, and it's a field of study. It's very specific, concerned with the ethics implications of certain biological and medical procedures. Now, as technology brings us forward, we are developing lots and lots of procedures that can be questionable, and certain sort of religious backgrounds and certain cultural beliefs, some people would not be sort of comfortable with some of the things that are being developed now. So everything, any new development must have an ethical assessment really about, is this ethical? Does society accept this behavior? And here I've given you some examples, such as organ transplant. I mean, in the early days of organ transplant, there was huge ethical questions about was it appropriate, especially when they're using they were using animal hearts and things in the early days. Now they're using humans, but there are still ethical questions to answer about where do you get them from? Are they sold? Are they not sold? And in some countries, as I said, the ethics are different. In the UK, you're not allowed to sell any organs. They have to be given freely. So it's quite a complicated process, and it's very well managed from a central point. So when people die, and if they carry donor cards, then you're able to harvest, kidneys and hearts, eyes, things like that. But if they don't carry that card, you're not allowed to do it, and there's lots of legality tied up around about giving permissions and things like that. And as I said, it's illegal to sell organs, especially kidneys, because they think it's unethical. Now, I do know that in other countries that the sale of organs such as kidneys and that is actually quite common. Um, so therefore, it's not illegal. So some people may well travel to other countries to get their kidney transplant, but it's not the way it goes about in the UK. They want to make it fair, and so it means that it doesn't matter who you are, whether you're rich or poor, you don't stand more chance of getting a heart transplant. So the rich guy over there doesn't stand in the UK any more chance of getting a heart transplant than the young child over here who comes from a sort of fairly poor background and whose parents could never afford such an operation. There is a list. The list is national, and everybody's identified at a level of priority. So, and your wealth and your status do not affect the level of priority. And like I said, this is not necessarily the same in all countries, but this is the way it's done in the UK. So this shows you that ethics are different in different cultures, really. As I said, bioethics, study of ethical issues raised by, and some of the questions that might come up is that, you know, when do you let somebody die? When do you withhold treatment? When is it killing someone, and when is it just letting them die? That debate, many assignments have been written on that question. Human cloning, a big issue at the moment because we can already clone animals and can clone individual organs like ears. Again, they're trying to clone kidneys. Um, but what about if you wanted to clone a whole human? Lots of science fiction films about that, but it is a question that needs to be addressed because the time will come. And we have to think about what are the ethical issues about cloning a whole human being. At the moment, they can't clone a brain, but who knows? Does society have an obligation to provide universal health care? Has everybody got a right to health care? And again, that differs from country to country. In the UK, that's considered a given right as a citizen that you have a right to universal health care. I know it's not the same in other countries. So those ethical discussions will be different in different places. So if you start trying to think in an ethical way, start to try to get an idea of the sort of tussles that some doctors, consultants, particularly, because they often the ones that make final decisions, but also as nurses and healthcare workers, you might have to make. Here's a classic bioethical decision. See what you think. So you've got one heart available, and all these people are matches, and they've all got the same level of need. So they're all at the same point, say on the donor list. So you could give it to any one of them acceptably. So you've got a 17-year-old girl, 40-year-old school principal, and a 70-year-old woman. What criteria do you think you would use? You might want to stop and jot down some ideas and think about this if you will. Think about what criteria you might use to decide who you would give it to, and maybe sort of give some thought to who you would give it to. Like I said, if you want to pause the screen for a minute and have a little think about that. Okay. You've got a young, bright looking 17-year-old girl, all her life to live. 40-year-old school principal is in middle age. He may have children. He may have a family. Probably. He's got an important role. He's worked very hard to get where he has. His school relies on him, so he's got an important role. 70-year-old woman. Okay, she's in her retirement. She's much older. She's already lived her life. But you don't know what she's contributed. She may have contributed something vastly important that we're all very grateful for. And, she may be a grandparent. She may look after somebody's children. Lots of things to think about, really. How on earth would you make this decision? Have a think about who you might give this heart to. Sometimes your gut reaction can be the best one. See what you think, okay? Okay, but what if afterwards you find out that none of these are looking after their body very well? Some by their own choice and some not so much. 17-year-old girl, although she's young and relatively fit looking, she's an intravenous drug user, so she's pretty much hammering her body really, and that might be the cause of her heart need. We don't know. Okay. The 40-year-old man who's just tipping into alcoholism, maybe, stress of work, etc., and who's going to end up drunk in the streets, maybe even jobless and homeless in a couple of years. You might have given your heart to him. Is that a good idea? Is it not? The 70-year-old woman, through no fault of her own, is living in poverty. She's finding it really difficult to look after herself. She, hasn't got much income. She's got no family to support her. So she's, it's a real struggle for her to look after herself, keep the place clean, keep herself clean. Would that change your mind in who you gave the heart to? Now, there is no right wrong answer to this, so I can't tell you, if you wanted to WhatsApp me and say I think it should be so and so, you can. But there is no right answer, really. You've got to sort of think about set some definite sets of criteria. And you need that criteria set up before you make this decision, as you can imagine. So you can see why the transplant coordinators do a very complex role. And that's why they have very, very clear legislation and decision making processes all mapped out and charted out. so they don't have this complex ethical decision. But even so, sometimes things arise because there'll always be other doctors sort of pushing their client first, because because we all get tied up with our clients. Our older lady who's no fault of her own had a really hard life. The young girl who you think you could save from drugs if she got a heart transplant, so on. Everybody will be pushing a different person. So the transplant coordinator has got to really, really weigh up the decisions, and they've got to be able to prove them to obviously the distressed families who don't of the people who don't get the heart. So you can imagine. So ethics is not the study of what's legally right or wrong, or even just what's socially acceptable, although it leans towards socially acceptable, but not necessarily the law. It's about what people think is morally correct. So who decides what's morally correct though, if we're not always following the law? Like I said, with the transplant coordinators, a lot of people got together and created a process, with all sorts of people being involved in it, and it was done by a group, and finally it was agreed on. So people trying to bring in every aspect they could think of, but it's not about following the law, because sometimes the laws don't work for people. There are laws that can be morally bad. In some countries, laws that discriminate against certain people in their society for whatever reason, they can be bad. So sometimes we know that obedience to them is more morally wrong than disobedience. So imagine when one country declares war on another, maybe not all the people feel that it's morally justified. Maybe they're declaring war because of greed, or because of some of the attitudes that they've got, or because they're intolerant to another country about the way they exist. None of it is justification for war, but some countries do it. We know that. I mean, all of us can. A lot of the people that I teach here are refugees, and you are refugees often for a reason, because you're either discriminated against because of your religion, your culture, the sort of person you are, or you may have been living in a war zone, and war zone has nothing to do with your making. So sometimes, even though the country you live in, it's the law, sometimes there is a moral issue to actually rise above that. So when we're looking at ethics, especially medical ethics, we don't always look to the law. The law can sometimes hinder us. Sometimes we have to make a cleaner decision than that. So medical ethics has some particular principles which we're going to talk about, and you need to be aware of, because you need to be able to write about them really, in your discussion. So I want you to focus on these particular principles. Give me a little summary of them. That will probably answer 2.1. Okay. So the main principles we're thinking about is autonomy, beneficence, null maleficence, and justice. Okay, those are the principles of medical ethics. If you wonder why they use such long names, well, let's face it, doctors like talking in Latin. I think you've probably come across that sometime in your life. So, they tend to use these long, complicated words. However, we can drill these words down to sort of simpler meanings. So let's think about let's have a look at those main principles, see what we mean by them. And all these principles include sort of specific issues such as telling the truth, informed consent, end of life care, doctor patient relationship, and issues about honesty and respect. Okay, if you go right back, as I said, to Hippocrates and his early oath, he picked up quite a lot of these things a couple of thousand years ago. So quite impressive, really, and the meaning of them hasn't changed that much. So we're going to start looking at beneficence, and beneficence means you do things to serve the best interests of your patient or your client. Okay, and it's about promoting the well-being of others, so being benevolent, look, seeing that others do well. So whenever you make your decisions about what to do, you do it for the well-being of that individual, not to make them worse, not to cause a problem for them. Okay, so beneficence can be translated as doing something that is beneficial to them. So the word beneficial and benefit comes from beneficence. Okay, they're all connected together with a Latin base. And the principles of beneficence is that everything is done with the intent of doing good. You do not carry out a procedure where you know you will do harm intentionally. You may be carrying out an experimental procedure that can go both ways, or if you make a mistake, it can go away. But what you need to do is, if you know that procedure and you know if you do it correctly, it will be beneficial. So obviously, if you make a mistake, that's a different thing again. And it demands that healthcare providers develop and keep up their skills and their knowledge and their training so that they can always be working in the best interest, so that they don't make these mistakes. They're always trying to do it. So whenever they carry out an operation or a procedure, they're doing it to their best of their ability. Okay, the patient's well-being is the first consideration, and everything you do is to improve the patient's health. Now, the next one, which is another bit of a mouthful, is called non-maleficence, and it's quite similar to beneficence, which is always do good, but it deals with situations where you've got no good choices. And it's saying to the doctor or the practitioner, do the least harm possible and harm to the fewest of people. And it was Hippocrates again who came out with the big line, do no harm. And a lot of doctors use that as their byword, and you'll see it on a lot of medical schools, logos, do no harm. And it is their watchword, really. So what Hippocrates was saying was, okay, you've got a disease, you may not be able to stop everybody catching it, but do the best you can. Reduce it so the least amount of people get sick. Okay. And if you've got two things that you could do, both of them might not completely cure someone, find the one that causes the least harm. Think about the side effects, think about the after effects. You don't just chop someone's leg off because their toe hurts. Okay, you could do. I suppose it would solve the problem, but it certainly won't be the least harm. But you might remove the toe, or you might, cut some section of the toe away and then maybe they might have a bit of a limpy walk, but they've still got 2 feet to stand on eventually. So you've done the least harm. Okay. The next principle is autonomy, something we probably understand quite well. We've talked about this before in other units. It goes together with a lot of our codes of conduct with the 3 C's. It's about people having the right to control what happens to their body. And it's about your clients being informed, being able to choose, accept your care plan, accept your interventions, and to be able to say no if it's too much for them and they don't want it anymore. So people have the right to control what happens to their body because they are free and rational. We do have some difficulties when we decide that people no longer have competency, and we've talked about that in other units as well. And then there are certain tests that have to be made, and then there are processes for independent people making decisions for someone. But if they don't meet that test of incompetency or lacking of capacity, then we assume that people are free and rational to make their own decisions, and they have to be respected. And sometimes the decision might not be in the best interest of the patient, but it might be what's important to them. One of the examples you might have who's someone who has got a terminal diagnosis. Now, they could have lots and lots of intervention, which could probably prolong their life by a year or two. But they've had so much intervention that it's making them sicker and making them, making the times in between so unpleasant that it's very difficult for them to function at all. Some people may choose to stop the interventions. They know they're dying anyway, and they'd rather sort of die in their own time rather than have it extended by lots and lots of treatment that's actually making them feel really terrible. And it's something that we quite want. We're always wanting to keep extending people's lives as long as we can, putting in all these interventions because it's what we do. It's the way we're trained. But actually, some people have a right to say, you know what, this is really horrible. I'd rather just stay at home with my family, stop taking all these medications, and make me feel so sick I can't walk. When I don't have them, at least I can, sit up and be part of the family. Yes, I know I might die a year earlier, but really, this is better. So, some people may choose about quality of life. They'd rather not have their life prolonged in a very poor way. They'd rather have a shorter life but a better quality of life. But the choice remains theirs. You can only give guidance, really. Um, they have a right to accept treatment. Also, some people have so different spiritual and cultural needs that don't allow them to accept certain treatments. Thinking of people who are Jehovah's Witnesses aren't allowed to take blood transfers. Now, this can be quite frustrating when you know you can save someone's life, but it's a decision that they've made. You always ask them again. Some people do change their minds and say, "Yes, I want it." But to be honest, if people say no, you've got to roll with it really. And it's tough. It's tough when you know that the injury's not that bad, and with just a couple of pints of blood, they could probably walk away from it. The principle of veracity, that's another mouthful, really. Again, it's using the Latin. Veritas, veritas means truth. Okay. Veracity means telling the truth. So it's an obligation to full and honest disclosure. So when someone says to you, "Am I dying?" you have to answer them really as a professional. Okay. Is he going to die? There's no point just lying to people and then they come in the next day and their husband's dead and they think, well, how did that happen then? So you've got an obligation to tell the truth to people and to tell them what's happening. Remember, it is their bodies, it's their lives as well. The principle of confidentiality, we've discussed this in other units. We know it's based on trust. We know we need to maintain confidentiality of all personal medical treatment. We know information should only be revealed with the consent of and for the benefit of the patient, except when it's ethically and legally required. And that's when you have to disclose some abuse, and when the law actually works around it, or ethically you can't keep it quiet, because maybe someone's, you know, um, had another member of staff done something to them and they disclose it to you. You say, well, you have to tell them that I do have to tell other people because we need to do something about it. Sometimes you have to tell the police. You are not a priest. You don't have that exemption. Someone told you they just murdered somebody and the police come asking the question, you have to answer. It's a different type of confidentiality. As I said, you're not a priest, you're not their religious support. So ethically, legally, in most countries, not answering that question would put you in breach of the law because you're perverting the course of justice. But even when you do disclose, it should be the minimum. It should be the minimum that's required. You should only disclose what needs to be disclosed. You don't need to give the whole backstory and everything. You just need to disclose what's required. Now, whenever you work in care homes, you will do some extra confidentiality training. You will find the home will have a specific policy on it, and you do need to sort of keep up to date with the policies, really, and make sure that you're comfortable with managing confidentiality. And another principle is justice, which is a bit more complex because sometimes it's not in your hands. And it's about fair treatment of individuals, equitable allocation of dollars and resources. Certainly in somewhere like the UK, where the NHS is free at point of entry for all, we have to be very equitable. We have to divide it up fairly. And as I said, um, a gentleman who's a millionaire wouldn't get the heart transplant ahead of a young girl who's got no money at all. It would be based on the level of need, which one of them is closer to death, which one of them would take the heart better. But those are the decisions. So it's about treating fairly. Now, unfortunately, justice needs to be aspired to. If medical resources are scarce, sometimes they don't always get distributed equally. But really, the aim for certainly us as professionals is to do that. So when we are caring for people in our care home, we need to treat them all equally and treat them all fairly, and bearing in mind people's diversity, that some people might need some extra support, but to make sure that everybody is treated in a just and fair way. Now, this is such a complicated thing because it brings up the question, who has a right to healthcare? And as you can imagine, there are professors of ethics in medical schools all over the world having massive debates about this. And some will say one thing, some will say another. So I would suggest, if you're interested in that, you can do plenty of Google reading on it. You can give some examples if you want of where there is injustice. That's fine. But do know that as individual professionals, we aim to provide justice as much as we can, bearing in mind that we still live in a country, and the decisions are made by the government. So we can't always do what they don't give us the money for, really, or they don't give us the chance to do. What is an ethical dilemma? It's when people's values conflict, when there's no clear consensus about the right thing to do, or when there's a conflict between your moral obligations. And, these sort of things come up, really, and they will get debated to the nth degree. As I said, there are professors of ethics who spend their time just doing that, which is very good because it saves us all doing it. And then often they come up with recommendations for certain circumstances. So you will always have an ethical dilemma in your job somewhere along the line. None of us escape it. But the best thing to do is to sit down as a team and discuss it, and come to some sort of consensus. And then you've done the right thing. There are loads of questions that we all hear about that are considered to be the right thing to do. Um, Things: should a parent have a right to refuse immunization for her child? Or is it the child's right? If a child can't speak, should parents say no on their behalf? Some people say yes, some people say no, no, they've got no right. They can make themselves ill, but why should they make their kid ill? Other sort of ethical questions. Give some of these some thought. Maybe discuss it with a friend. It makes for a very interesting chat, or with your family at home. Should children with serious birth defects be kept alive? Very costly to society. And, what's the quality of life like? Should a woman be allowed an abortion for any reason? Now, this, you might look at this differently depending on what your religious beliefs are or your own personal moral beliefs. Should you torture a terrorist to find out information which might save hundreds of people's lives? He might know about a bomb that's going to be put off somewhere. Should you torture him to get the information? That's the difficult one. And that's something you could talk about for ages. As I said, there is no right or wrong. Who should get the finite numbers of organs for transplant? Go back to our young girl, our, middle-aged school principal, our elderly woman. Were you clear in your decision, or were there lots of things that you couldn't, might stop you deciding? Should you be able to buy organs? Now, as I said, I know that it happens in some countries, certainly not in the UK, you're not allowed to. But those of you who might be in countries where you can buy them, what do you think about that? Is it right? Is it proper? There is no right answer, but these are interesting discussions to have with people. And they all are elements of ethics. So there's something you could use. One of these statements you could use as an example to show that ethics is a moral question and an open question. So what are the ethical dilemmas that faces nurses or care workers or health and social care workers? Well, they've got the issues of protecting a patient's right to do something, also giving fully informed consent. You must always get people's consent to your treatment. Managing confidentiality breaches and knowing when you have to breach it and when you don't. Respecting someone's cultural or religious beliefs, not making decisions that really, cause a conflict for them. And then supporting people in making major life event decisions, like I said, about people maybe stopping their treatment when they were terminally ill or extending their treatment, those sorts of things. So, with their day to day work, normal everyday work, you've got these ethical dilemmas floating around in your head all the time. Sometimes it's easy, you know exactly what you should be doing. Other times, there may be a scenario that you encounter that could make one of these principles quite difficult, and you have to stop and think for a minute. And you can't see my purple explosion there under my video, but it just, the word is stress, and all of these dilemmas can cause you stress. So you need to be aware of that. And as I said, the most important thing is don't always make the decision on your own, but talk to your team, talk to your superiors, talk to your supervisors and your managers. Share that decision. This is what I think is going on. I'm not sure if it's the right thing to do or not. Nothing wrong with that. So how does it affect nursing? It's all about stress. Okay? When a patient's refusal for treatment is inconsistent with best medical practice, we all find that very painful. We try to explain, but we can't push them. So that can be very, very stressful for you as a carer. When we're short of staff, when we're stretched for time, these decisions start to become really a big deal. Do I have time to go and talk to the team? We can't sit down and have a nice relaxed team meeting. So that can cause, that adds to the stress really for the carer. But you've still got to sort of remember to do the right thing. Okay, preparation for 2.2. You'll see that I've added 2 case studies in your extra reading. And I want you to do a bit of a practice run, really. You've got the case studies, and you've got a little set of questions for each of the 2 case studies. And just to practice getting your thoughts organized, try and answer the questions that are for the case study, because that will give you the time to look at them in a bit of a fuller way. And when you come to write your assignment, the task will ask you to choose one of these case studies. You don't need to write about both of them. You only need to choose one of them. So that's why I've given you the 2, and to do in your private study time, practice what your answer might be. And then you can choose which one you're going to write about. Okay. Because 2.2 will be asking you to assess what the ethical issues are in that case study. So all you need to do to me is to sort of tell me, what are the ethical issues that have happened in that case study. Okay. But we will talk about that in next week's slides when I actually talk you through the assignment. So beforehand, just read through the case study, answer the questions. You don't have to send it to me. If you do want to ask me anything about it, please WhatsApp me. You know the drill. You don't have to send that to me, as I said. Just keep it for your own preparation. But it just gives you some time to get your head clear and sit down and think, okay, which of these case studies am I going to want to write about? You might find one of those case studies a bit easier to explain than the other one. That's not a problem. You can choose whichever one you like I said. So having a little practice at it is the way to go. Okay, that's pretty much the end of my slides. I've got a couple of references there for you. As I said, do have a look into your extra reading, and there's also a little quiz for you to do for this week as well. Okay, and I will see you for week 4. Okay.